disorder and the return to school. Just to remind everyone, if you could mute yourselves as you're entering. If you'd like to send any questions as we go along, please feel free. I will be monitoring the chat, and I will try to get to all questions throughout this evening. When school first closed on March 13th, I never imagined that in August we'd even be in a place where we'd be questioning if our kids would be going back to school. But here we are, and the stress that children and families are experiencing are quite high as parents try to grapple with back to school decisions. So today we'll be discussing post-traumatic stress disorder in the context of COVID-19 and the impact on the return to school. As I just mentioned, feel free to ask any questions as we go along. You can use the chat feature to send questions to me or the moderator. The chat icon is located at the bottom of your screen. Just so you're aware, many of the points that I'm going to make today are coming from the CDC and the National Child Traumatic Stress Network. I encourage you to check out these resources for additional information. So we are going to start by talking about what is post-traumatic stress disorder and what types of symptoms we look out for. But I first wanted to make a comment about over-pathologizing during this very unusual time. There's a large range of normal when it comes to how people are adjusting and responding to the pandemic. I think we underestimate how severe and adverse the COVID-19 pandemic is, and people, including children and adolescents, are experiencing a fairly normal reaction to something that is severe, ongoing. It's an ambiguous disaster. So it's important to understand that it's normal in this time to have anxiety, to experience chronic stress, and because of that, to have some fluctuations in mood, maybe some exhaustion, maybe a sense of feeling empty, depleted, even burnt out. I'm sure many of us can relate to those feelings right now. So we really need to be kind and forgiving to ourselves and really kind and forgiving to our children. You'll hear me say that more than once tonight. So let's start by talking about what is PTSD. I'll briefly discuss the criteria for post-traumatic stress disorder according to the DSM-5, and we'll start by talking about PTSD in adults and children over the age of 6, and then I'll talk a little bit about some of the differences for children under the age of 6. While I'm talking, I am just going to share my screen. Technology, want to make sure I have what I need. All right. So let's see if this works. Yay. Okay. PTSD criteria. So when we're talking about the PTSD criteria, we're looking at an exposure to an actual or threatened death, serious injury, or sexual violence. Within that criteria, we're looking at directly witnessing a traumatic event, witnessing in person the event as it occurred to others, learning that the traumatic event occurred to a close family member or friend, or experiencing repeated or extreme exposure to aversive details of the traumatic events. And for this particular item, we are not talking about images on social media or TV. We're really talking about repeated images that are happening through work, such as first responders, police officers, doctors and nurses in the emergency room. We also need the presence of one or more intrusive symptoms that are associated with the traumatic event. When we talk about intrusion, we're talking about recurrent, involuntary, and intrusive distressing memories of the traumatic event. For children over the age of 6, repetitive play may occur in which themes or aspects of the traumatic event are expressed. A person might experience recurrent distressing dreams. In children, the dreams may be frightening, but the content may be not recognizable. Flashbacks in which the person feels or acts as if the traumatic events are recurring. For children, trauma-specific reenactment may occur. And intense or prolonged psychological distress at exposure to internal or external cues. The next item we look at is avoidance of stimuli associated with the traumatic event. And within this criteria, we might see avoidance or efforts to avoid distressing memories, thoughts, or feelings, or we might be looking at avoidance or efforts to avoid external reminders. These are people, places, conversations, activities, objects. The next criteria is negative alterations in cognition and mood. And in this category, we look for two or more of the following: an inability to remember an important aspect of the event, persistent and exaggerated negative beliefs about oneself, persistent distorted cognitions about the cause or consequences of the traumatic event that leads the individual to blame themselves, persistent negative emotional state. We're talking about fear, horror, anger, guilt, or shame. Diminished interest or participation in significant activities, feelings of detachment or estrangement, or a persistent inability to experience positive emotions. The next criteria we're looking at is marked alterations in arousal and reactivity. And so within this domain, Within this domain, we're looking at irritable behavior, angry outbursts, reckless or destructive behavior, hypervigilance, an exaggerated startle response. This is like jumpiness, problems with concentration and sleep disturbance. For a diagnosis of post-traumatic stress disorder, the symptoms have to last longer for 1 month. They cause clinically significant distress and impairment, and it's not related to the physiological effects of a substance or due to another medical condition. So those are the criteria for adults and for children over the age of 6. It's very similar for children under the age of 6. The differences are in terms of exposure. The traumatic event can be through learning that a traumatic event happened to a parent or a caregiving figure. In the case of COVID, this would be a parent or a caregiver becoming sick or dying from COVID. In terms of intrusion symptoms for kids under the age of 6, the intrusive memories might not necessarily appear distressing, and they may manifest themselves, they may come out through play. And in regards to dreams or nightmares, the content of a dream for a young child may not necessarily seem related to the traumatic event. And also notable for children under 6, you need either persistent avoidance or negative alterations in cognition, but not both. And so it's a little bit easier for a child under the age of 6 to be diagnosed with post-traumatic stress disorder if they meet all of these symptoms. So individuals with PTSD, including children and adolescents, may be quick-tempered or even engage in verbal or physical aggression with little or no provocation. They may also engage in self-destructive behavior, such as driving dangerously, using substances, or self-injurious or suicidal behavior. Individuals with PTSD may be very reactive to unexpected stimuli. They may display an exaggerated startle response or jumpiness to loud noises or unexpected movements. Concentration difficulties, poor attention, and trouble with sleep onset are commonly reported. You may also see a developmental regression, such as the loss of language, the loss of toilet training skills, the loss of an inability to for the child to put themselves to sleep at night. Irritable and aggressive behavior in children and adolescents can really interfere with social relationships and with school functioning. So One big question is, can COVID-19 actually cause post-traumatic stress disorder? And I will answer that question momentarily, but I want to check if there are any questions so far about anything that I've mentioned. Don't hesitate to send your questions through the chat, and I'll try to get to them. All right, we will keep going. So does COVID-19 have the potential to cause post-traumatic stress disorder? The simple answer is yes. The COVID-19 pandemic is certainly an unexpected event that can cause fear and even panic. However, since the pandemic is still ongoing, it's actually more useful to look out for signs of traumatic stress rather than a comprehensive picture of post-traumatic stress disorder. And so for children, if they are showing signs of traumatic stress, we'd want to make sure that we are intervening, and we'll talk a lot about how to support children through this difficult time. But it's not necessary for children, really for anyone, to meet criteria for post-traumatic stress disorder for others to be concerned. We really are looking out for any signs of traumatic stress. So according to the National Child Traumatic Stress Network, children who experience traumatic stress have been exposed to one or more traumas over the course of their lives, and they develop reactions that persist and affect their daily lives even after the events have ended. A pandemic, such as COVID-19, is in fact a traumatic event, but not all children exposed to a traumatic event will develop traumatic stress. Many factors contribute to symptoms, such as whether they've experienced a trauma before, and we're going to talk a little bit more about that shortly. Whether they are hearing and seeing frightening news on TV or social media, and whether they know someone who has become ill or died, especially a caregiver. The experiences of children can vary greatly based on their level of exposure, as well as how others in their immediate environment are responding. So for example, a child who's exposed to repeated stories on the news or social media of severe illness or death may experience more distress than a child who's rather insulated from such news. A child whose caregivers are able to be relatively calm and reassuring may experience less distress than a child whose caregivers are overwhelmed with worry, panic, or grief. Therefore, a child's reaction can be very much strongly influenced by how others around them are reacting. I want to reiterate again that it is completely normative for all of us, including our children and adolescents, to be experiencing high levels of stress and anxiety during this pandemic. However, it should seemingly come in waves with periods of calm and maybe even happiness and pleasure in between. When a child's experiencing traumatic stress, their reactions interfere with their daily life and ability to function and interact with others. So traumatic reactions can include a variety of responses, such as intense and ongoing emotional upset, depressive symptoms or anxiety, difficulties with self-regulation, problems relating to others or forming attachments, aggression or loss of previously acquired skills, attention and academic difficulties, nightmares, difficulty sleeping and eating, and physical symptoms such as aches and pains. Older children, teenagers may use drugs or alcohol. They may behave in risky ways or engage in unhealthy sexual activity. Children who suffer from traumatic stress often have these types of symptoms when reminded in some way of the traumatic event. And in the context of COVID-19, reminders are literally constant and everywhere. Even kid-friendly shows air information about COVID-19, which can serve as a reminder. At no age are children immune to the effects of traumatic experiences. Even infant and toddlers can experience traumatic stress. And the way that traumatic stress manifests will very much vary from child to child, and it will depend on the child's age and their developmental level. Kids are definitely fairly resilient. As humans, we're generally fairly resilient. But if you do have concerns that you or your child is experiencing a traumatic stress reaction, it's important to seek treatment. Don't wait for the symptoms to become worse. Without treatment, traumatic events can affect the brain and the nervous system and increase health risk behaviors such as smoking, eating disorders, substance use, and high-risk activities. Research shows that child trauma survivors can be more likely to have long-term health problems such as diabetes and heart disease, and even to die at an earlier age. Traumatic stress can lead to increased use of health and mental health services and increased involvement with the child welfare and juvenile justice systems. So in a moment, I will talk about how we help our children cope with the return to school in the context of the pandemic and in the context of potentially some kids experiencing traumatic stress. But I want to check to see if there are any questions at the moment. So far, the chat is clear. I'm not seeing any questions. All right. So before we talk about strategies and how we help children cope with the return to school, I just want to talk really briefly about individuals who have previously been diagnosed with post-traumatic stress disorder or have previously experienced traumatic stress. If you or your child have been through traumatic events in the past, you may have learned effective coping strategies and you may be functioning relatively well at this point. Or it may be the case that the pandemic has greatly triggered PTSD symptoms. You or your child may feel more on guard or unsafe. There may be more triggers to which one is reacting. You may not engage in activities that are still considered safe. There may be an increase in negative thoughts and feelings, and there may be more difficulty with concentration. Coping skills that have normally been used may not feel as effective any longer. If this is the case, returning to treatment may be a useful intervention, in which case you may only need a few booster sessions to kind of get those symptoms back under control and well managed. But I encourage those that have been through a trauma in the past to reach out for help, to engage in meaningful activities, and remember to use good self-care during this time, which can be really helpful in managing symptoms of PTSD. Self-care is a little bit of an interesting topic because most of the things that we think of as being useful for self-care really are not that much available to us. And so it's really going to take a lot of creativity for us to figure out what we need and how to take care of ourselves. So I've definitely shared a lot of information, but I want to spend majority of the time talking about how we support our children to lower the risk of traumatic stress and how we support them in their return to school. Again, feel free to ask any questions as we go along. The idea of returning to school for some kids may produce high levels of anxiety and distress. This may be particularly true if they are a caregiver or in a high-risk category, or if they or a loved one has become sick with COVID, and especially if they know someone who has died from COVID. In those situations, the concern over the return to school may be even more heightened. On the other hand, you may have a child who's fairly resilient through the pandemic. Your family has coped relatively well, and they're on the other side and feeling a lot of disappointment about remote learning or reduced opportunities for in-person learning. Whichever boat you, your family, your child is seemingly in, we'll discuss some ways to support them through this very unusual transition back to school, whether remote or in person. First, I want to acknowledge the deeply difficult decision that most parents and caregivers are facing right now with whether or not to send their children to school in person or to keep them home for remote learning. In some cases, it may be a life or death situation. At least it may certainly feel like a life or death situation. In making the decision, parents absolutely have to do what's in the best interest of their family. Considering all things such as the health of all family members, work schedules, access to other child care or resources, and the child's learning needs and overall level of functioning. Um, the CDC has created some helpful guides for parents that I think are particularly useful. I am going to try to share my screen so that you can see the links. The first link is a decision tool to help parents and guardians weigh the risk and benefits of the available educational options. It goes through what we know about COVID, who's at higher risk for severe illness, and it provides a checklist to help you identify your family's level of risk. Hold on, can't find what I'm looking for. There we go. Okay. And the second link is a checklist to assist with back to school planning. It identifies ways to prepare, whether you're going back to school in person, remotely, or through a hybrid. Whoops, sorry. So I definitely encourage people to check out these resources. I think they're really helpful. I think it makes a decision that seems very ambiguous a little bit more concrete, and it can take you through sort of a decision tree to help you decide what's best for you and your family. And so I think those are really good resources. Okay. So let's talk a little bit about what we can do to support kids during this time as they're getting ready to go back to school. I think one important thing that's really important is to help kids understand that life is different right now. I think it's important for us to have a level of acceptance that life is different right now. It's a really crappy situation, and some days are going to be tough, and that's okay. We have a new baseline. However, acceptance is not the same thing as giving up. It just means that we're not resisting or fighting this new reality so that we can apply our energy elsewhere in a more productive way. It also means expecting less from yourself and from your children. I think, we usually hear, we got to set the bar high. We got to have high expectations for our kids, and they'll rise up to their expectations. And this is very much an American cultural way of thinking. And I think in normal times that seemingly works for us, but I think during these really challenging times, we should actually be doing the opposite. We are really all trying to figure out what we need during this time, and children and adolescents are no different. So we have to expect less from our children and give them opportunities to replenish more. We need to expect less from ourselves and give ourselves more opportunities to replenish more. No one can function at full capacity with everything that's going on. So many of our natural support systems are limited, whether that's church, community organizations, schools, obviously, and a bunch of other systems that we've relied on. So we have to recognize that we are all grieving multiple losses: the loss of structure, the loss of routine, the loss of social networks, the loss of friendships, the loss of feeling in control of your life. There's so many losses that we're all grappling with right now. And the future is ambiguous and uncertain. And so we need to show ourselves self-compassion and teach our children to do the same. I think that as caregivers, parents, educators, teachers, we do a really good job of teaching our kids how to be kind to other people, how to say things to others that are helpful and not hurtful. But I think during this time, it is also equally important to teach our kids to be kind to themselves. And so for adults that are out there listening, if you haven't quite mastered self-compassion, that would be a good skill for you to start practicing as well. We all need to be a little bit kinder to ourselves during this time. Um, hold on, I'm going to share my screen so that you guys can see some of this. Okay. So that was number one, help children understand that life is different right now and to build some level of acceptance around that. Number two, communicate, communicate, communicate. It is so important that we are talking to our children. Take the time to communicate with children and listen to their concerns. So when I say communicate, sometimes adults like to do a lot of talking, but sometimes we might need to do a little bit more listening. Check in regularly. This is not a one-time conversation. We should be checking in with our kids and providing them ample opportunities for them to express their thoughts and feelings. Be sure to validate their concerns. It's our natural instinct as parents and caregivers to say, don't worry about it. But in this time, it's really important to validate and not minimize the concern. Helping children to recognize and explore their feelings can give them permission to cope with their distress. It can also normalize the experience for them. At the same time, it's really important to provide your child with factual information appropriate to their level of development. So for younger children, you're going to want to keep information brief, keep it simple, try to stay as positive as possible. For older kids and teenagers, you can certainly provide more level of detail. Share information about what's being done to keep everyone safe in order to provide some reassurance. Help your child or teenager understand what's being done in your home to keep them safe, what's going to be happening in their school system to keep them safe, and what's happening in the general community to keep them safe. For older kids, they may try to present as if nothing is really bothering them. They may not want to talk about the situation. I think it's important that as adults, we're opening the door for the conversation. So even if your child or teen is not quite ready to talk, they know that when they are ready, you're available and ready to listen. So in regards to back to school plans, share details as you have them. And it's definitely okay to say, I don't know, but do share the details that you do know. When school starts, you may go to school some days and stay home some days. I don't know exactly what that's going to look like yet, but once I do, I'll be sure to tell you. And then make sure that you go back and tell them as you do find out additional details. And when discussing the return to school in general, help the child focus on the positives, whatever that may be. So for in-person learning, they might be able to see their friends and their teachers again. For remote learning, they might have additional opportunities to spend time with family, take walks in the middle of the day, whatever you can think of to kind of put a positive spin on whatever option they'll be doing. I have a 5 and 7-year-old, so kindergarten and second grade, who will be remote learning at least for the first month. And they are so excited to have meetings like mommy during the day. And I laugh, I'm like, we're gonna see how long that lasts. And I'm gonna remind you that you said that. Okay, so communicate, communicate, communicate. Share the details as you have them, focus on the positives, and don't forget to listen. My next recommendation is about allowing children to own their feelings. Help children identify and cope with difficult emotions. Share with them some of your reactions and feelings and how you've coped with them in the past, what you've done to manage your own distress, whether you've talked to others, whether it's writing or drawing about your feelings, or doing something positive to help others. It's not really realistic to expect children to learn how to manage their emotions if we never share with them times that we have felt distressed and then model how to cope effectively. Encourage your child to use expressive outlets for managing their stress. Younger children often can express themselves through imaginative play. Teenagers may use means such as poetry, writing, art, music, those types of activities for emotional expression. My next recommendation is about teaching flexibility. Flexibility is the name of the game. I think the only thing that is really certain is that things are going to continue to change. So really helping our children learn how to be adaptable and sort of go with the flow. Um, we've already experienced so many changes, and it's likely the changes are just going to keep rolling in. So helping our children learn to be flexible and to adapt to a changing situation will set them up to be as successful as possible. So for my kids, we often use we use the metaphor of a duck and how the duck has oil on their skin and the water just rolls off. And so we talk about when things happen that are upsetting or that are unexpected, we're just gonna let the water roll off of our back like a duck. My 5-year-old likes to say, "Let the water roll off of your butt, off of the duck's booty and shake it." And so yes, flexibility is the name of the game. Um, I can't express how important it is that as adults we are taking care of ourselves during this time. It's sort of like when you get on an airplane and they're giving you instructions for safety and they tell you to put on your oxygen mask before you put on someone that's next to you or before you try to assist a child or someone else. It's really the same kind of concept here. It's so important that as adults, whether we're the aunts, the uncles, the parents, the educators, whatever role we're playing in the child's life, it's really important that we're taking care of ourselves. Emotions are contagious, and children and teens are observing the ways in which their caregivers and soon their teachers are managing their own distress. So make sure your basic needs are met. Don't forget to eat. Don't forget to drink lots of water and fluids. Having a good routine for yourself so that you're maximizing your amount of sleep. Take a break when you need one. Check in with your loved ones. Practice relaxation strategies to reduce your own distress. And also monitor yourself for your own traumatic stress reactions. In order to provide optimal support for our children, it's essential that the adults are caring for their own mental health during this time. I really can't stress that enough. Let's see. So giving options and choices is a really important thing during this time. Part of what causes the stress and anxiety is having this perceived lack of control. And COVID-19 is the perfect disaster that kind of increases all elements of distress. So it's important to teach your children what they can do to have some control in their lives, whether that's washing their hands, covering their sneezes, not hugging friends. Empower your kids to make healthy choices. And also, as you go through planning their daily routines and their schedules, build in choices as much as you can. Do you want hot dogs or hamburgers for dinner? Would you like to take a shower or a bath tonight? When we give children a sense of control, anxiety and distress can be reduced. With the return to school, it'll be really helpful to identify areas that are within your child's ability to control. This is especially true for kids that are going to be returning to in-person learning. So for example, letting the child have their own hand washing routine and figure out what's the best way they want to go about washing their hands. Or teaching your child during this time how to properly wear a mask or how not to touch their face. Helping them with scripts for what to do if someone gets too close to them and they start to feel uncomfortable. How can they communicate this to a teacher? How can they communicate this appropriately to a peer? Role plays and practicing can be really helpful in reducing anxiety. It's true with anything. The more we practice, the more mastery we have, the more confident we feel. And so this will be true too for kids going back to school. The more they feel armed that they can have some control over their environment, the less likely they'll be to feel distress while they're in school. Um, During this time, it's going to be really, really important for parents and teachers to maintain really good communication. And it doesn't matter whether it'll be remote learning or whether it'll be in-person learning. It's going to be so important for good communication to happen between parents and educators. For teachers and educators, you guys are the front line in recognizing concerns regarding children's mental health. So it's important that parents and educators remain in contact with how our children are coping. Social emotional functioning is all the more imperative during this time, and it'll be quite challenging for children to have the bandwidth, the capacity to focus on learning if they're really struggling with their mental health. So for teachers, share your concerns honestly with parents. And you know, while some children in distress will act out, other children will suffer in silence. And so be aware that that children respond differently. And so the kid who is disruptive should get as much attention and concern as the child who's withdrawn and not talking and not really engaged. And so for those of you who are educators, really keeping your eyes open for those kids that may really be struggling, whether it's with anxiety or depression, traumatic stress, or a true post-traumatic stress disorder. For parents, it's equally important that you share your concerns with teachers. If your child has a history of anxiety, depression, trauma, other mental health challenges that may be exacerbated by the pandemic, it's really important that teachers are aware so that they can monitor your child's presentation, so that they can provide additional support, so that they can intervene when needed. And again, all of these things are important whether the child's going to be in person, remote, or in a hybrid. It's still important for our kids, for ourselves, that we're spending time with friends and family in a safe way. While social distancing is still recommended, social isolation is not. This is really, really important for adolescents who really kind of rely on their social environment for support and for self-esteem. Teach your children and adolescents safe ways to stay connected to friends and to other trusted individuals. When home, it's really important that you find ways to spend time together, not necessarily at opposite ends of the house. And family members should take time for enjoyed activities. Even though we're in the midst of a pandemic, it's really okay to smile and laugh sometimes. Those things are really important overall in reducing distress and anxiety. And while I say it's important to spend time together, it's also important that there's an identified way for people to have alone time when needed. Some of us respond best by relying on others to help us cope when we're distressed, but others really need time for ourselves to cope with our stress. And so it's important to have a balance. You want to spend time together, but you also want to make sure that if someone does need the opportunity for some alone time to process their emotions or to just feel their feelings, that there's a space and a time for them to be able to do that. Okay. Don't wait for symptoms to get worse. If you have concerns about your children, if you have concerns about yourself, reach out. So for younger children, when they're experiencing distress, it's really important to provide comfort and physical contact, lots of hugs, lots of cuddles, whether you have a toddler, an infant, a preschooler. For older children and adolescents who sometimes don't want to be kissed by their parents or touched by their parents, even a small gesture, a pat on the back, giving them a stick of gum to chew, bringing a glass of water while they're working. All of these things convey care and compassion and empathy and can go a really long way in mitigating the risk for traumatic stress. If you have a child who is seemingly anxious or on edge, it'll be really important to limit scary movies and images. Scary things on TV, through social media, can really increase fear and anxiety. And so if your child is already having some difficulty coping, I would make an extra point to make sure that they're not being exposed to anything anxiety producing unnecessarily through TV. Having a soothing bedtime is really important. It's important for everyone, not just children and adolescents, but also for adults. What the routine will look like will vary by age, but a bedtime routine is definitely recommended for people of all ages, and a similar routine for weekdays and weekends, especially now that we're getting in the back to school mode. Having as much consistency between weekends and weekdays will be beneficial for kids. Model healthy coping skills: breathing, yoga, meditation, distractions such as playing games, talking with someone about feelings. And if the struggles persist, please seek help from a professional therapist or a counselor. If you're not sure, it's definitely okay to reach out and for someone to say, you know, in the context of what's going on, what's happening for you and your child is completely normative. Here are a few strategies. Reach out if you still need help. Or a counselor can say, you know, these symptoms are concerning. Here are some things that we can do to start mitigating this distress now. And then for urgent mental health concerns, I want to make sure that people have access to this resource, 1-800-273-TALK. It is a free resource, 24/7 access to a crisis counselor. And so if you or a child is experiencing concerns about safety, harm to themselves, harm to someone else, that is a great resource to call 24/7. You can also chat with the crisis counselor online at www.suicidepreventionlifeline.org. And again, it's another free resource 24/7 if you're having an urgent mental health concern. Okay. So that is all of the material that I had prepared for tonight. But if there are any questions, I'm happy to answer any questions that are out there. Also, this recording will be placed on YouTube if you want to go back and review it. And if you would like to reach out to Franciscan Children's for any support, consultation, you can certainly reach out to us through our website. There's a behavioral health tab where you can submit questions or concerns, and a clinician will get back to you. Looking at the chat, it is all quiet. That must mean I was very efficient and explained all the details. Again, help is available. It's out there. No one has to suffer alone. We're a community, so reach out to us. We all have to help each other through this very, very challenging time. And again, if you have questions afterwards, feel free to reach out. But otherwise, thank you so much for joining me, and everyone be well.